Today we are very grateful to have the privilege so that we can speak regarding our health, which is very important. As you all know, my name is Michelle Charles, and we have Suzette Lane and Monette Matthews. We will be speaking about cardiovascular diseases, right? How they affect us and what can we do to prevent it, amongst other things, because when we talk about cardiovascular diseases, most of the signs, symptoms, treatment is basically the same. So we just put a package about diseases that is very prevalent that affects us, okay? Cardiovascular disease is a group of disorder affecting the heart and blood vessels, and it is the leading cause of death worldwide. UK statistics shows approximately 1.9 people in England alone lives with coronary heart disease. So this is a big figure. 1.9 persons in England alone that have heart disease, okay? So it is something that is very prevalent, and we need to know what we can do to prevent it, okay? Cardiovascular diseases, we have coronary heart failure, we have heart failure, arrhythmias, deep vein thrombosis, peripheral arterial diseases, valve diseases, and pericardial diseases. This is just a list of diseases that affects the heart, right? We won't go in depth because, it's a lot. But we're going to talk about this one. It says myocardial infarction. Has anyone ever seen this word before? None? It seems like a big word, but it actually means a heart attack. Myocardial infarction is the medical term for a heart attack, right? We simplify it by saying MI. So what is an MI, or what is a heart attack? A heart attack, it occurs when blood flow stops or decreases in the arteries of the heart, causes tissues to die and the muscles to be weakened. Okay, so basically a heart attack is when the blood flow to the heart is cut off at some point. Most of the time it is because of a blood clot. It is because of fatty tissues. It stops the blood flow, and anytime oxygen is not flowing, there is a deterioration, it becomes necrotic, and the tissues die. Okay, the most common symptom is retrosternal pain. We say pain in the middle of your chest. Anytime you have that pain that prolongs for a long period of time, then it is something to look into. It is something you need to ask your doctor about it. It is very serious, okay? So once there is a blockage in the heart artery, it causes a heart attack, right? Here we have a diagram of what really happens. Here is the blockage, and then we can see the muscles around it decaying, darkening. It turns necrotic, right? So when there is a blockage in the veins or the artery, it cuts off the blood supplies. And when the blood supply is cut off, then you have a heart attack. One of the main reasons as well is lack of oxygen. When there is not enough oxygen that is supplying the heart, you get a heart attack. And it is very serious, because a heart attack, sometimes it is symptomatic, it shows signs, and sometimes it don't. You can be walking and think everything is good, and then you just get a heart attack. Some people have severe symptoms, but some people don't. So we have to be careful. Right? The most common symptom of a heart attack in some people, especially women, older adults, those with diabetes, are seen unrelated to heart attack. So you might say, okay, I'm getting a pain in my chest. Maybe I have ulcer. Maybe because I am a diabetic. But most of the time, it is because of a heart attack is brewing. So church, anytime there is a pain in your chest, do not take it slightly. No matter how long it persists, and do not self-medicate. We love to say, okay, I'm going to buy an aspirin and take it. Don't do that. We like to find alternative methods. Boil bush, as back home, you know, them older adults, they always have a remedy for everything. Please, find your GP and tell them what's going on, okay? Because a heart attack is very serious. And it could happen in split seconds. So we have to be very careful. Sometimes there might be nausea and pain in the neck and the back. The difference between the pain when you are getting a heart attack is that it goes to your upper part of your body. So it starts from your chest up, and then it radiates to your neck and mostly to your left arm. So anytime you have this left arm pain, it's a heart attack that is about to happen. And most of the time, even if you sleep, even if you rest, the pain does not go away. That pain, that persistent pain, is leading to a heart attack, right? Some heart attacks strike suddenly, but many people have all the warning signs and symptoms hours or days or weeks in advance. You have to pay attention to your body, because the symptoms that I might get, you may not get it. Everybody will not share the same kind of symptoms. And anytime your body feel off, do not take it slightly. Okay? Don't say, okay, I'm getting this gradual pain, but it has been lingering for a while. Take it seriously. Pain is a symptom that is telling you that something is wrong with your body. A high temperature is telling you there is something that is wrong with your body. So please pay attention. We have cold sweating. Most of the time we attribute cold sweating to diabetics. But it is a sign of a cardiac arrest that we need to take serious. Shortness of breath. The reason why there is shortness of breath attributed to heart attack is because of the lack of oxygen supply to the muscles of the heart. When that happens, your heart is picking up speed because it's trying to flow blood through your body. So shortness of breath is something we have to look out for. As I say, upper body pain. The pain starts from your chest right up to your neck. It is a sign of heart attack with chest discomfort. I remember back home I was working in a polyclinic and I was the only nurse on duty. And when I opened the clinic the morning, a woman came to me and she was hunching like this. And she keeps saying, nurse, I can't breathe, I can't breathe. I have been up all night, I can't breathe. She was cold sweating, but I did not really take it for anything. When I checked her blood pressure, it was like 230 over 150 something. That is an emergency case. By the time we finished everything, she fainted. She was getting a heart attack. Luckily, the doctors wasn't too far. So swift intervention saved her life, right? We have to look out for these warning signs when it comes to heart attack, okay? How do we prevent a heart attack? What do we do? This is the important part of it. What do we do to stop these things from occurring, right? The first one is the most important. Healthy diet. 99% of the sicknesses in our bodies are caused by what we eat. 99% of the diseases is caused by what we eat. The fatty food, the fried food, the oil, the refined sugar. These things build up in your body and causes a lot of diseases. It's not to say that you cannot use them, but use them moderately, right? Moderately. Start with increase your fruits intake, vegetables, whole grain, reduce your salt intake and your sugar, your fats, the amount of fried chicken that we eat, the amount of rice that we eat. Reduce it. Reduce it. We need to start living healthy. Healthy eating, right? I love my fatty food as well. I love my fatty food as well, but it is not healthy. Instead of frying your food, you can bake your food, right? Air fry your food. It is better than the oil that we take. Regular exercises is important to keep your heart flowing, to keep your heart going. Regular exercises. I'm not saying for ladies, we say we exercise when we clean in the house. We say we exercise taking care of. No. It means going for a long period of walk. Engage your heart. Sweat a little. Sweat. When we sweat, we are detoxifying our body. You understand? It is important to keep your heart going. Some time ago, a friend went to the doctor. The doctor tell her, you are young, but your heart is way older than how you are. Lack of exercising, lack of eating the right meat or the right food, that your heart is way advanced. So you can be 20 years old, but because your lifestyle choices isn't right, you have a heart of a 30-something years old. It happens. And that's why it is very important what we eat. Avoid tobacco, limit alcohol, right? Regular health checkup. When is the last time you went to your GP? When is the last time you had your blood pressure tested? When is the last time you had your glucose test done? These are important because when you do your regular checks to your doctor, it catches any disease very early. Very early so that it can be treated. But if you don't go, they cannot help. And most of the time, you're already stage 1, stage 2, stage 3 going when there is no help. So as healthcare professionals, we are urging you, make an appointment to see your GP, okay? Medications. There are medication that is prescribed for high blood pressure, cholesterol, and heart conditions. Sometimes the doctors give you a medication to take, you put it in your drawer, and you leave it there. I'm not taking this, I'm not taking that. We do not know more than the doctors when it comes to health. And God has placed them in place to help us. So if they give you a medication to take, once there is no serious side effect, please take your medication and take them on time. Stress management. And for the ladies, we love to bottle up everything inside. We love to hold things together inside. Please, find someone to speak to. Find an outlet. Because stress is one of the #1 cause of a heart attack. So much emotions building up that even the pressure on the heart is too much. Find some way to talk about issues that are affecting you. For me, this one is not going to bother me because I'm a talker. I love to vent. When something is bothering me, I will say exactly what it is. Do not bottle things up inside of you. It causes serious heart attack, okay? Cardiovascular disease is a complex multifactorial condition that can affect anyone, but early detection, lifestyle modifications, and appropriate medical care can significantly reduce the risk of severe outcomes and improve the quality of life. Okay?
So that's, am I? If anyone have any after? Okay. Okay, so we'll do the questions after.
I was just saying something before Michelle starts. When one of the things to do when you feel the symptoms of a heart attack is to start coughing. Take a deep breath and cough because it forces your lungs to take air in and it forces the heart to pump. That's why when the doctor tells you to rest, because your heart is not where you're supposed to rest, because effort makes the heart pump. So if you feel that way and an ambulance is on the way or you're alone, start coughing like mad. It would seem crazy, but you're forcing your heart to pump and you're forcing your lungs to get air.
Okay, so that's a very good point. It's a very good input from Sister Monette. Okay, so I'm going to continue and I will be speaking about hypertension. This is something very popular that a lot of us are aware of, or we know it as high blood pressure. Okay? So high blood pressure is a chronic condition in which the force of blood against artery walls is too high. Okay, and it also increases the risk of heart disease, as we heard Sister Suzette was speaking about. It also increases the risk of stroke, kidney disease, and other complications. So with hypertension, it is also known as a silent killer. The reason why we call it silent killer, because you can have hypertension and you don't know. You know, often we see clients, they come, they're gonna go to the doctor, and when you do their blood pressure, it is extremely high. You ask them, do you have any symptoms? Do you have any headache? Do you have any blurred vision or anything like that? And they will tell you no. But however, their blood pressure is extremely high. So that is why we call it a silent killer. Okay, so that is why it is good that every now and again you get your blood pressure checked. You visit the GP. Okay, according to statistics, 1 in 3 adults worldwide has high blood pressure, and it is a leading cause of preventable deaths, right? Preventable deaths, which mean that you can prevent high blood pressure, okay? It can be prevented. High blood pressure, it also can cause serious long-term damage, and it also the number one disease that leads to stroke, okay, which we'll speak about later on. Regarding high blood pressure, I know sometimes we go to the GP or we at the hospital, they test our blood pressure and we don't know what's the normal range is or how it is. So the normal is normally 120 over 80. That's normal, okay? So if you're between there, you're good. Anything above 130 to 139 or 80 to 90, it is being classified as hypertension stage 1. So you're there. So you need to do something regarding that. And then anything above 140, 90, that's stage 2. And you become hypertensive crisis when it's 180, above 180 or 120. You know, oftentimes at healthcare professions, we deal a lot with hypertensive crisis, okay? I remember back home in St. Vincent, you know, I was working in the community. You know, I'm the head of that clinic, so they say. You know, sometimes I ask my husband, I'll be at that clinic from morning, sometimes I reach home until night, trying to stabilize, to get somebody blood pressure, stabilize. Oftentimes, my husband will say, well, it seems like you're the doctor too. I say, yes, I have to do my job. I'll just call the doctor and he will tell me, he will prescribe the medication, whether or not I have to give it through IV, oral. Sometimes, you know, oral don't work, so I have to do it through the vein, you know, the faster way to help prevent further damage, whether further damage of the heart or to prevent the person from getting a stroke. You know, so sometimes I'll be there and I never reach home until in the night, just trying to get that person blood pressure stabilized. The causes of high blood pressure, according to studies, they say the age, within your age. But recently, I've noticed age is not just the elderly person, but a lot of young person are getting high blood pressure, and that is because of their food intake. You know, the young people, they like a lot of fast food. They'll go for the McDonald's, they go for the KFC, you know, all those fast food. So and Popeyes, yes. Yes, so they have a risk of also getting high blood pressure. And family history, according to them, genetic. If there's a person in your family that have high blood pressure, you're predisposable to get that as well. And also other things that can lead to that is excess salt intake, as Sister Susan had mentioned. You know, that causes retention, and it causes fluid retention, and it raises your blood pressure as well. So we have to use everything in moderation. I'm not going to tell you to take salt off of your diet, but use in moderation as well. Physical inactivity, if we don't exercise, you know, it leads to weight gain, and then vascular stiffness, and then we become obese. And you know what happened? Bams, high blood pressure. As earlier Pastor Dave said, if you want an exercise partner, you have our beloved Pastor Okanta. He will link you to the gym, okay? So just speak with him after, and he will tell you what to do. And ladies as well, yes, we have to exercise as well. As Sister Suzette says, not just the housework, but everything that we do. We must exercise to keep that heart of ours going and pumping, keep that blood flow as well, our veins and our arteries. And also smoking and alcohol consumption. That also, you know, over smoking and, you know, smoking as well, you know, it also damages our lungs. You can get lung cancer, especially if you start early. That also, smoking and alcohol consumption, that also can increase our blood pressure. And another thing that, another study showed that the intake of caffeine also, I know we are in the UK, we love a lot of caffeine. It do increases our blood pressure. I can't speak for myself because I remember after I had Jeremiah, I love my coffee. It does nothing to me, but I realized lately that when I drink the coffee, it increases my blood pressure. So I have to stop. Sometimes, you know, if I have a craving for it, I might do decaf, which doesn't taste good at all. I don't like that. Yes, but I have to look after myself. Yes, I have to look after myself. I love coffee a lot. If you give me the chance, I drink coffee 24/7. Yes, I know. It don't prevent me from sleeping. You can ask Sister Suzette. She knows a lot about me. Remember back in Cuba when we have exams, they always said, drink coffee and it will keep you up. And guess what? I'm downstairs. I remember they leave me outside there on the bench sleeping. And all of them, they went up and they peeped down from the dorm and they laughed, and I was there sleeping. Coffee? It have no effects on me. Don't keep me up. Yes, moving on. Symptoms and signs of high blood pressure. You have severe headaches, right? Severe headaches, so that's a sign to look out for. If you're at work and you say, boy, I have this headache, get your blood pressure checked. Blood vision, it also affects your vision. You're unable to see. Chest pain as well. And if you don't look out for yourself with that chest pain, it can cause you to have a heart attack. So all these diseases, they are linked, right? It's like hypertension. If not taken, you can end up and get a heart attack as well. Shortness of breath and also nose bleed. So these are these are some of the symptoms to look out for. Confusion or difficulty speaking. You're trying to speak, but words not coming out of your mouth. And severe anxiety, nausea and vomiting. And also it can cause seizures or loss of consciousness. That when you are really in hypertensive crisis. Okay? So if you are, any of these symptoms, it's good to seek medical attention immediately. Okay? Complications from high blood pressure, as I said earlier, heart disease such as heart attack, heart failure, excess strain, thickness of the heart muscle, and increase the risk of heart attacks. Also stroke, which I will go more in depth later on. Stroke, ischemic and hemorrhagic stroke. And as I said earlier, hypertension is the leading cause of stroke I'm working in a stroke unit, so I'm aware of this. And also chronic disease, chronic kidney disease, hypertension again, it damages your kidneys and it can lead you to kidney failure, okay? This kidney failure, if your blood pressure, if it's not taken care of, it's not under control, these are the kind of damages. It can damage your organs inside of your body. And you don't want that because you don't want to be in the hospital. You don't want to have to end up on dialysis. So prevention is the key. And also vision loss. It can damage the retinal blood vessels and it can lead to blindness. I'm sure none of us want to be blind, right? All of us want our vision. We want that vision. And ways that we can prevent high blood pressure is we can reduce our salt intake. That can help lower the blood pressure. Weight loss. So if you realize that you're gaining a lot of weight, it's, you can look into yourself, weight loss, can go on a diet. Yeah, and don't start your diet today like me. Every day I'm on a diet. Ask my husband, ask Suzette. Every day, Michelle Charles is on a diet. And that diet never started. Regular exercise, limit your alcohol and caffeine intake, and stress management as well. How we deal with our stress, that is also important because you don't want to end up in the hospital because of stress. As Suzette said, offload. I'm not the one to offload. Sometimes it takes me a while, but I'm getting there. I'm the one who keeps things inside, but as the years go by, I tried my best to, to speak out and to say what is bothering me. Sometimes we can use different things to offload our stress, like music. You understand? I know I love music. I love my worship. Or sometimes I put on those fast music, and I dance. I love to dance, as everyone knows. I love to dance a lot. So you can find ways and means if you love to read, if you love to watch television, or something funny. A comedy, sometimes you might can go on TikTok. They have some short, funny videos, and you can laugh yourself away, okay? Even though people might think you're crazy, but you're just releasing your stress. So we find different techniques, and even prayer. You find a corner, we find somewhere, and we pray. We ask God to take care, deal with that situation. I can't deal with it because you don't want to end up in the hospital with stress that cause high blood pressure. And yes, and another thing that I always love to say, I'm saying to myself and I'm saying it to everyone, remember that health is wealth.
So one of the things I'm going to talk about is diabetes mellitus. You would hear people call it DM, they're talking about diabetes. So it is a condition that happens when your blood sugar or blood glucose is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly, and that is called insulin resistance. So when glucose is in your bloodstream, it needs help to reach its destination in your cells. And this insulin, a hormone, is what your body uses to process this sugar. So when you don't have enough, that's what happens that leads to diabetes. So the signs and symptoms of diabetes. There's polydipsia, excessive thirst. Polyuria, frequent urination. Polyphagia, excessive hunger or increased hunger. Pruritus, that's itchy skin. Paresthesia, that's numbness in your hands and feet. Fatigue even when you have rested. Unexplained weight loss. Blurred vision, frequent infections, and recurring headache. But I have something that might surprise you. Sometimes you might not be symptomatic, and the only thing that might tell you is if you get an infection, probably a skin infection that just doesn't go. And then that would be a trigger for your GP to test your blood and see that your blood sugar is elevated. Sometimes your body just doesn't show these things. And you can get diagnosed with another telltale sign that would make your GP think and test your blood sugar. So it's not limited. These are the telltale signs, but it's not limited to these. So the different types, there's pre-diabetes, there's type 1, there's type 2, there's gestational. And there's actually another one, but in the UK, they don't really diagnose it. It's called 1.5. That's where you have a combination of the symptoms of type 1 and 2, but not the full symptoms of each. So pre-diabetes, this is the stage before type 2, when this is basically where your blood glucose is going up. So normal blood sugar, if you just do the finger test, it should be between 4.2 and 7. And if it's close to 7, you need to check when last did I eat. And if you have eaten more than 2 hours before, then you need to get your blood tested, because a person without diabetes, their blood sugar really shouldn't be going that high. So with type 1, this is an autoimmune condition where the body's immune systems, it attacks and destroys the insulin-producing beta cells in the pancreas. So there is little or no insulin production at all, and it leads to very high blood sugar levels. Some of these people, they are actually born like that. From baby, you see them with the monitor in their leg. That's where they put it for babies. So, and it could also develop in adulthood as well, or teenage years. So when you have type 2, the insulin in your pancreas, it's still there. It's being produced, but it doesn't work properly. It doesn't produce enough. So everything has a range. And you might do the blood test and you might be on the lower end of normal. And because you're so low but still within the normal range, it's still not enough, so you will still be diagnosed as type 2 diabetic. And your blood glucose level will just keep on rising. And gestational diabetes, this is the one that happens during pregnancy, and it should normally go down after you've given birth. If it doesn't, then they class it as type 2. So the risk factors are family history or genetics, age, ethnicity, history of gestational diabetes, obesity, lack of exercise, unhealthy diet, medical conditions such as PCOS, and medications like steroids or antipsychotics. So prevention and management of diabetes, maintain a healthy weight, healthy eating, regular physical activity, avoiding smoking, and managing stress. And here, alcohol. Too much alcohol, most alcohol beverages, when it goes into your body, it breaks down into sugar. So avoid excessive alcohol use and get screened for early detection. Medication. Something here that I mentioned, you see healthy eating? A lot of times we think we need carbs in our meals, but we don't. You can go for days without eating carbohydrates and you will be fine. Especially if you have a lot of glucose in your blood, that gives your body a chance to use it up as you walk, as you do things. So if your blood sugar is going high, like you're in the pre-diabetic state, my advice to you, cut down on the carbs, especially at breakfast, and don't have your dinner too late with a carb. If your blood sugar is on the rise, the best time to have a carbohydrate is at midday. Not too early, but not too late, so you're giving your body a chance to work it off before bed. Thanks.
Okay, so we're going to continue and I'll be speaking about stroke, right? So stroke also, yes, I know a lot of us, we are familiar with stroke. And growing up, When we heard about stroke, we'll say, boy, this is something for the elderly. But now, it's not. It pains my heart when I see the young person come into the hospital, being admitted with stroke. So it have no age limit anymore, as we used to say. So stroke is, it's simple. This is when blood stops flowing to a part of your brain, okay? It can affect the things like speech, movement, and it's a long way to recovery. And it also needs urgent medical attention because it is life-threatening. So I'll be sharing some of the symptoms of stroke. So one, face weakness, right? You might see a side of your face may have a droop or fall. And you might find it very hard to, find it difficult to smile. Arm weakness, you may not be able to fully lift both of your arms. So your arms, you're not able to lift them. You might have like mild weakness, severe weakness, or none at all. You're not able to lift your hand. And also numbness. Speech problem, you may find that your speech, it may be slower or none at all. It just sounds, or you're completely mute. Nothing is coming out. I've been seeing this every day. Every day. I'm seeing this, or you're confused. There's an acronym that we use, right? It's FAST. And with this, it will help you to identify that if you are having a stroke. So the acronym FAST, F is for face, A is for arms, S is for speech, and T is time, right? So all of those symptoms that I spoke about, that I just mentioned a while ago, if you're at home and you're experiencing these kind of symptoms, please don't dial 111. Call 999 immediately because your life can be saved there. Okay, so moving on. Sometimes even with symptoms, you can feel dizzy, like you're falling over. You can also have a severe headache. And that severe headache, or you're feeling, or you're being sick, nauseous, or vomiting, right? So the severe headaches, most of the time when we have clients coming to us, they complain about severe headache. It's also because their blood pressure is extremely high, right? And high blood pressure is the number one leading cause of stroke. Yes. So cause of stroke. Studies have shown that you are over 15 years, but as I told you, that isn't so anymore because a lot of young people are having stroke. When I tell you young, I think we see I think 19 years. Yeah, 19 years. 19 years old with stroke. So it's not 50 anymore. You don't have to wait until you're that old to have stroke. If you have any underlying diseases such as sickle cell diseases, that also can lead to stroke. Any unhealthy lifestyle, that also can lead to stroke. Any unhealthy lifestyle, as we mentioned earlier, you're not eating properly, that can also lead to stroke, causing different complications, whether you have the heart, your kidneys, etc. That also can lead to stroke. If you're pregnant and you have preeclampsia, that also can lead to stroke because of the blood pressure. And if you just had a baby, you can also have stroke. I've seen that, I've witnessed that for myself, where I saw mothers just having baby and they are warded because they have a stroke. You know, mothers, after we have baby, sometimes we figure that, oh boy, my body, the baby is out, I'm back to myself. So we find ourselves doing everything. We do the housework, we cook, we clean, we do everything. But that time, that's when our body is it's not time yet for that. It's time for us to, relax, take deep breath, take care of yourself, and take care of the baby as well. There are different types of stroke, right? So we heard about stroke, yes, that one word, but we have different types of stroke. So we have ischemic stroke. When we hear about ischemic, it simply means a blood clot, right? So that's a blood clot that blocks blood flow to the brain. And that is one of the most common type of stroke, right? You have the hemorrhagic stroke. This is bleeding. This is when the blood vessel, it bursts. So that's another type of stroke. And we have a transient ischemic stroke. We call it TIA. It is a mini stroke, right? So you might hear a person said, boy, I have a mini stroke. But we have to be lookout. That resolves itself like within 24 hours. But you have to look out because it's sending a signal that, oh boy, this person definitely is having a stroke. So, with this, when they come into the hospital, they do different tests. You may do an MRI scan, do CT scan, just to rule out what it is that you have. If it's a blood clot or if it's the bleeding. If it's a blood clot, there are ways now that they will remove the blood clot. We call it thrombectomy. That's where they do it mechanically, where they will go in and they actually remove the blood. They remove it. The blood clot is being removed. If you have hemorrhagic stroke, according to how, if you have a large bleed, then you will require surgery as well, where they will you will have a drainage, and that will be drained from your head as well. So so as time goes on, things are being developed, and thank God you're in the UK, because back in our country we don't have this kind of facility. If you have a stroke, you start count your blessing, name them one by one. It's either God heal you, or it's either God heal you, it's either you pull through, or you start your preparation for your make preparation for your funeral. That's how bad we have it. Amen? Amen. I'm speaking the truth. And yes, I'm speaking the truth. So things that you can do, to reduce, to prevent smoking, to prevent stroke. You quit smoking, have a balanced diet, exercise, cut down on alcohol, right? And if you have any underlying condition, such as high blood pressure or diabetes, please get yourself checked. Take your medication. I know sometimes, as Sister Monet say, we have our medication and then we'll not take them. Or we will say, let me just forget that. Or we just go and we eat anything and then we end up in the hospital, right? So please, I'm urging everyone as much as possible. Let us do the right thing so that we won't have to end up in the hospital with a stroke. Not the stroke, but any of the diseases that we mentioned earlier. And as I also tell you, health, it is wealth. Wealth is not just riches. We may think that, oh boy, wealth is riches, money, having luxurious houses, the latest car. I don't know what's the latest car is. What is the latest? Anybody know what is the latest car? A Jaguar. I think I saw Pastor with one. Pastor, you have a Jaguar, right? Yeah, boy. Yes, so we think that is well, but seriously speaking, your health, it is the wealth. Because every morning you can get up, you can walk, you can do things for yourself. That alone is wealth. Okay? Now, this morning I have literally forced myself to be here because I have real severe back pain. I don't know where this is coming from, but my husband, he told me this morning, he said, but you're a nurse. I said, don't worry, I'll deal with that after church. Yes, so it is really important that you take care of yourself. Okay?
To add to what Sister Michelle was saying, there is this spice that we use back home, the nutmeg. I don't know if you all are familiar with it. If you are at home by yourself and you feel like you're getting a stroke, just put it under your tongue and just suck it. It decreases or it stops stroke from happening. The nutmeg, just rest it under your tongue and just suck on it. And it stops stroke from happening. Okay?
It's me again. So I'm going to speak a little bit about substance misuse. So that's my specialty. So I wouldn't speak about all of the different types of drugs or substances because there are a lot. What I will do, I will speak about alcohol, excessive alcohol, and heroin, maybe crack or cocaine, and see, just for you to see how they damage the body and lead to either diabetes or stroke or heart problem. So, sorry, I don't have a presentation. So, heroin, it is what you call an opioid. Basically, it's a painkiller. And some of the strong painkillers that are used in hospital are derivatives of heroin. Derivatives mean that they stem from it. So the use of it, as you know, it's a drug. It is highly addictive. And it could be smoked, it could be injected. People find all kinds of ways. Somebody even ate it, which is very bad for your bowels. So what it does, it causes serious heart problems. It slows your heart down. That's one of the things that it does. And it causes your heart to have arrhythmia, which is irregular heartbeat. It also leads to low blood pressure. And it leads to the slowing down of your respiration, which has an effect on slowing your heart down. And then everything just leads to possible heart attack or heart attack. So it just goes to show that it's not everything is caused by that. And I wasn't sure if I should speak about this, but to be honest with you, I know it is a church setting, but you would be surprised at who sits in front of me when I cover for the nurses, because I don't do frontline. When I cover for the nurses, you'll be surprised at who could be sitting in front of me. People who work in schools, people who work in mental health. They themselves have mental health issues and take drugs and need help. People who are trainee nurses, as in student nurses. So you don't know who could be dependent on something. I'm not using the term addicted because we are moving away from that because it's very degrading, but the truth is the truth. So when you're dependent on something, you're basically addicted to it. So yes, it could be anybody. We are among people who are on things and we don't know. And it's not just those types of drugs. Anything could be a substance that is abused, even herbs. The next thing I'll just briefly talk about is alcohol. So as Christians, some people don't drink it at all, some drink in moderation. The key is to not get drunk. However, excessive alcohol seriously damages your liver. It causes your liver to get hard, and it's in stages. So you start with a bit of fatty liver, then it will get scars, and then it stops working. So it's just for us to be mindful not to overdo it with alcohol. And it affects your pancreas because of the sugar content that most alcohol drinks have. It affects your pancreas and it can lead to diabetes. When it leads to the liver damage, after one major organ is affected, others become affected. So you see, the abuse of substances can still lead to the same diabetes. Alcohol raises your blood pressure very high. So high that you would wonder if the person is doing something else, but it's really the alcohol. And crack or cocaine, they're the same thing, just a bit of a difference in the way, like the composition, but they're the same. That is a stimulant. And stimulant is something like, caffeine is a stimulant, so speeds up your heart, does all kinds of things. So it still leads to possible heart failure. And when your heart is affected, it could be, the next thing could be the lungs. That's usually the thing. Sometimes kidney. There's another drug called ketamine. Abuse of that, serious bladder problems, so much pain. So it's not worth it. I'm not accusing anybody here. I don't know anybody's business, but I speak about substance misuse in different forums because, as I said, you could be surprised at who is using what, at who is taking what. And we must not look down because substance misuse is a coping mechanism for stress and trauma. So everything is linked. Sometimes people can't cope with the stress. They're not healthy venters like me and Suzette. We talk about things. We speak to our friends, our family, and we pray a lot. if you don't have that healthy coping mechanism, you can easily turn to substances. I was speaking to a cousin of mine, and she said something, and it drew my attention to possible self-harm. She was very stressed out, under a lot of stress, and she pierced her ear, and she said something to me. The pain from the piercing made me feel like everything was let out. And for me, that's a red flag. Because people who self-harm is when they're under so much stress and pressure and they keep things bottled up. We must not keep things bottled up. Sometimes they look for a way to let that pain out. Pain is mental, pain is physical. So the same stress that can cause the heart attack, the diabetes, the high blood pressure, if you don't manage it well, you can find yourself using something. There's a herb found in Asia. It's called croton. And there are people in the UK that import it and use it. They drink it as tea, and then they find themselves can't come in off of it. They have to be detoxed off of it. So stress is a killer in many ways. Not only does it lead to diabetes, because when your stress level goes up, it makes you to not process or metabolize the sugar properly. And that's diabetes right there. It hardens your veins, so that's hypertension right there. And if you don't have healthy coping mechanism, you can end up using something and you don't even realize, hey, I'm actually addicted to this thing now. So it's just important for us to open our eyes and know what's going on around us. Seek help, seek counseling, seek mental health counseling, go to talking therapies. If you tell your GP you're really stressed out and you can't cope, there is something called talking therapies. They will refer you there, and you can self-refer as well. There are mental health trusts, there are mental health charities. Seek help, because don't feel that it's a problem that you can't see or touch. Stress affects your body physically, and you can end up on something that you don't want to end up on. You can just be in the wrong place, the wrong time. Somebody gives you something, and there you are, shaking, and then you ask them, what was this? And they say, oh, it was laced with a bit of something, and there you have it. So it's really important to get yourself checked out, not just physically, but mentally.
Thank you. So we are getting to the end of our presentation, but there is something I wanted to throw in today, and that is breast cancer. We are not going to go in depth into it. I just want us to know the signs of breast cancer, ladies. We love to look in the mirror and see, am I putting on weight? How do I look? So we are going to look at the signs of breast cancer. What are you looking for? What are the early warning signs of it? And the first sign is lump or mass in the breast. So you are examining yourself and you feel a lump. Sometimes it feels small and hard. Pay attention. Anytime there's a lump in your breast, it don't have to be cancerous, but don't take it slightly. Okay? See your doctor about it. Changing the appearance of your breast. The skin getting thick. That is a viable sign of breast cancer. Pay attention to how it looks. If there are dimples, if the nipple is retracting, if it's going in instead of out, what is the color around it? We have to pay attention, because a lot of ladies sometimes they have these things and they don't say anything about it. And by the time they reach to the doctor, you hear you already stage 3 and stage 4. But your body was warning you that something is off or something is wrong. You are not pregnant, yet if you squeeze your nipple, there is fluid coming out. That is not normal. We have to pay attention to that. Call your doctor. Is the fluid bloody? Is it clear? Is it greenish in color? Pay attention, right? Is it itching? Is your breast constantly itching you non-stop? No matter what you use, you have this itch going on. It is an early warning sign of breast cancer. Is there pain? Is there tenderness? If you touch your breast, it's pain. It is a sign as well of breast cancer. Right? Swelling of the lumps, the arms, swelling of the lumps around your armpit. That is a primary sign of breast cancer. And we have to pay attention. So I want to demonstrate how we do a physical exam to see if we have breast cancer. How do we check ourselves for breast cancer? There are two ways that you can do it physically, okay? If you are lying on your bed, you put your hand behind your head, right? So hand behind your bed if you are laying flat or prostrate, and then you start to palpate from one area straight wrong until you reach your armpit. Okay, let me demonstrate. Sister Michelle, come. Okay, so you're lying, put your left hand. Okay, put it here. Right. And you look yourself in the mirror, and then you start palpating in a circular motion, go right wrong. You are feeling to see if you have lumps, right? So you palpate, go straight wrong until you reach your armpit. If you are standing in front of your mirror, you start from this section of your hand and you palpate straight down to your armpit. Don't pass. Stay a while and check your armpit. And then you massage or palpate straight down until you reach to the nipple of your breast. If you have breast cancer, you will feel a lump. Sometimes you don't feel it immediately in the breast, but you might feel it a little lower up. So you start palpating from that side until you come straight down in a circular motion. Am I understood? Okay.
Okay, I'm accustomed to that. I will always be, since we are studying, I'm the one like the mannequin. So that's nothing for me. Yes, so Minister Lane, she spoke to the ladies, and mind you, men as well, regarding breast cancer. It's not just for ladies only, but also for men. Yep. So men, you take note as well. So we know that men, I'm going to speak just 5 minutes to the men regarding prostate cancer. I know we have men here, and men don't like to go to the GPs. It is true. I have a husband, so I know. So out of 100%, 1% of men will visit the doctor, right? So I'm going to speak to you regarding prostate cancer, right? Because it's also relevant that we teach the men regarding prostate cancer. This is most common in men who are over the age of 50. That's what they say, but it's not all that true, okay? So some signs that you men can look out for is that when you find it difficult to start peeing or you're having strain to pass urine, right? So that's a sign. You're having a weak flow of urine as well. You start peeing, you start, you say, okay, you're going to pass urine, and it's like, you start, stop. So that's one of the signs that you need to look out for as well. You're needing urgent, you want to go urgently to pass urine as well. Is that you can't keep it. You can't keep your bladder, so you have to keep running. And sometimes you might leak on yourself. So all these are signs that you need to look out for. You feel like you want to pee. You feel like you want to pee when you just did it. Right? So that also is also a sign of diabetes as well. That's another sign of diabetes. So you might get confused. But if you're confused, speak to your GP, and let them do that, relevant tests that they're supposed to do. Another other symptoms can be blood in your urine or blood in your semen as well. So that's one of the things that you have to look out for. Blood in your urine. So that's a danger sign right there. You also can have lower back pain. You're losing weight without you trying to lose weight. So these are signs that we have to look out for prostate cancer as well, and erectile dysfunction. And a lot of men don't like to speak about this, right? You're unable to get or keep an erection, right? So that also is a sign of prostate cancer. So don't be afraid, men. Go to the doctor. Speak to your doctor about it, because oftentimes with men, when they go to check to see if they have prostate cancer, they are already in the late stage. Late and final stage. Because, men, they say, this is just something normal. It's okay. It's okay, but it's not okay. You can save your life, and you could also extend your life as well. I think my hospital, I saw, but I didn't really read it thoroughly. They have, there's something that they're bringing out now regarding prostate cancer, that men's lives can be extended for another 10 years. Yeah, I saw that. My trust is into that. My trust, they'll do a lot of research, my hospital. Yes, so these are just some of the signs. Another thing that they say regarding it is black men, black African or African Caribbean ethnic background. They said that these men are tend to have prostate cancer. And you know the reason why? Because the black men, they don't like to go to the doctors and get themselves checked, right? They don't like that examination that they do. They say, oh, no, not me, and that. But it's okay. It is okay for you to get yourself checked as well. And then if cancer is, you have family history of person within your family that have cancer and so forth, go speak to the GP, get yourself checked to make sure that, no, I don't have prostate cancer. Okay? So I think that we are at the end of our presentation. Any questions? We are open for questions. Feel free.
Praise the Lord. So these kind of seminars are good for the churches. However, how can we, as a community group, promote a healthier lifestyle in the church? So we know the weather is hot. There's things that we can do as a church, but what can we do to promote a healthier lifestyle?
Okay. Yes, Brother Jeff. To promote healthy lifestyle as a church and to the community, even though the weather is hot, you can still do some exercises indoors. You can do exercise indoors because you don't want to be out there in the heat and, you get heat stroke. Also, intake of a lot of water. Encourage the kids especially, even adults, even at your workplaces, please take water. A lot of fruits as well. I will encourage you to eat a lot of fruits because, fruits, they have natural water. They come with that. That's how God made them as well. And we can promote, as a church, as one, we can also promote healthy eating, not just this forum as well, but, as time goes by, I know Pastor might have other ideas for us to do promotion regarding healthy lifestyle. We can go out into the community. We can have our little flyers and so forth hand out. We are promoting healthy eating.
Again, we can also do socializing. Like we can say, okay, today we are going by the park. Meet us there for like 5, 6 o'clock. We are going to do some exercises. That is a very good way that we promote it among ourselves. So we go to the park. Those who are really into fitness will be our guide. And, we're just there and we're doing exercises and, we come as a family doing that. We can also have some walks, some evening walks. The sun is hot, it goes down very late. We can take a short walk and come back together. It helps us to socialize, and we are actually socializing. And when we have our events, we do not want jollof rice. We want salad, okay? We want our salad. So that's what we can do.
After church service, walk.
Yeah, please, can I ask a question? Sister Suzette, you mentioned about checking, for women, checking the breasts. But way back when I heard from somewhere, I can't remember, about the size of the lump should be the most important thing. If it's the size of a 50 pence piece, means you need to go to see your GP. So is that a falsehood, or the size of a lump isn't relevant?
No, I don't want to say it's a falsehood. The size depends on the intervention. Your breast should not have lumps. I think the person misunderstood. According to the size, they would either go in with surgery, or, there are different treatments. There's chemo, there's radiography. Oh, my.
Mammogram.
No, the treatment.
Okay.
So, thank you, radiotherapy. So, the size is really about the intervention. You shouldn't have lumps. So, anytime you feel a lump, and sometimes it's not hard, it could be kind of soft. But the point is, it shouldn't be there. The tissue of your breast should be uniform. When I say uniform, it should all feel the same. Because, people have different type of breasts. Some people have full breasts. Some people have a bit more. Francis, leave me alone. Yeah, whatever the men call it. So the thing, what it should be is a uniform feel. It shouldn't have any lump, whether very hard or slightly soft. The size is what the doctors use to decide on how they would treat it.
Thank you. Thank you very much.
You're welcome.
Yes.
Having the possibility of having breast cancer.
I don't have proof. No.
Having it proved. Pastor is asking this question and everyone is saying, oh, is it true or false? Is breast cancer connected to the sucking of the breast?
No, Pastor. No, it's not
Why is
connected.
everybody say, hey?
Hey, it's not connected. False, false, false.
I have a question as well. Sister Monette, you mentioned that someone can be born with type 1 diabetes, or it can be developed in life. How does it develop in life, and what can we do to prevent that?
It could be developed. From what I remember, if you don't manage the type 2 well, your pancreas could get so bad that it stops producing. So when it stops producing, it becomes type 1. And it could also be autoimmune. If you end up getting something, I don't know, lupus, any autoimmune thing, it can still have that effect and you end up as type 1.
Let me add, Sister Christabella. Also, from birth, what can happen if the mother has gestational diabetes? The child is predisposed to have diabetes as well. So that's why when you have gestational diabetes, they will keep the child, your baby, they will monitor the baby blood sugar to make sure that the baby blood sugar is within the range, right? So children that born from mothers that have gestational diabetes, that we always have to have a lookout and keep checking their blood sugar as often.
then he fell down and died. You said that exercise keeps us healthy. How come someone who is always at the gym, running, something like this happened to you?
If it wasn't witchcraft, it was it was an underlying problem that he didn't know about. That's why it's good to have the regular checkups. You'll be surprised at what your blood test could show. The elevation or when things are low, it tells you something. Some people feel because they don't feel anything that they're fine and they don't go for checkup. There are people who don't go for any checkup at all. A year could pass, 2 years could pass. So, yeah, sometimes people look okay and they're not. So that's why underlying causes that they didn't know about. Or a strong ovia.
Or also substance abuse, you might be surprised. That as well. Because if they take the substance abuse that they are not accustomed to, it can also lead to death.
Last question from me, please. I think we spoke about the young people having more stroke now than before. Do we know why more young people are having stroke now?
Mostly it's because of the food intake, right? They are eating a lot of fast food and the salt intake as well. Because when they come into the hospital, you realize their blood pressure is extremely high, like 200 and something, yeah. Or if they have any underlying condition that they are not well aware of, from birth. Sometimes they are being misdiagnosed until when they reach like around teenager or even adult. That's when you realize, oh boy, I had this all the time until something happened. Yeah.
I have a question, please.
Wait, just 1 minute. According to what Brother Jeff said. Another thing is blood clotting. Blood clot is the major one reason for a stroke. So make sure that you are drinking a lot of fluid. Make sure that you're keeping your arteries clean. Regular detoxification is also good for us. Right? Detox your body. Get rid of the toxic. Get rid of the waste in your body. Because when it builds up, it causes a blood clot. And a blood clot can form any part of your body. And it travels upstream. Where does it go? To your lungs, to your heart, to your brain. And that's it. So be mindful.
Okay, please, can I just ask one more question about menopause, post-menopause and the hormonal belly? How can a woman of a certain age, because when I was young, I could lose weight just like that. Now, over a certain age, post-menopause, I can walk, I walk every day. Every day I walk. I go to the woods and I do the hills, everything, but the belly's not going. Any guidance or any help on hormonal
Yes.
bodies?
So you kind of said it yourself. It's hormonal. So just because menopause does that, that's why there's the HRT, hormone replacement therapy, and there are herbs that you can use. I know a lot of them because they don't just work for, I have taken them myself, but it's not for menopause, just female issues. These herbs, when you take them over time, they work like a dream. But you won't find the GPs telling you about it because they don't really promote alternative medicine. But where we train, for every system that we learn the pharmacology, the alternative, the physiology, everything. That's how we were taught where we trained. But in the UK, they don't really promote it. Ashwagandha, it's an adaptogen. When you take it regularly, it helps. Maca, it's another adaptogen. When you take it regularly, it helps. But it has carbs in it, so if you have diabetes, take that in moderation. But you see these two. There is something called Shatavari. There is another one. The scientific name is slipping me. But that one, epi something. No. I'll tell you the common name. Horny goatweed. It's not just for men. These help naturally with your hormone balance. You'll be surprised. But you don't have to take all of those that I listed, and there are more. But you see, if you could take ashwagandha with another one, if you can take two of those that are called adaptogens, give it some time. When your hormones aren't balanced, a lot of things happen. So during the perimenopausal state, that state, you don't have the hormones balanced. And it's not just for perimenopause, but women who work a lot, they're under a lot of stress. These hormones really help. These herbs really help. Or just get something from the GP, but that would be medication. But if you want, and there's something called evening primrose oil. That helps a lot of people. So how many did I list there? About 5, and there's more. Just right now, it's not in my head, but I know a lot of them. Okay.
Can I, just a quick one, please? I used to do work night, so since I just stopped doing the night work, I find it very difficult to sleep in the night. Is it due to stress or is it due to change of?
No, your body got accustomed to being up at night, which is not even healthy. That's a cause of diabetes, because night is for sleeping wherever you are in the world. Once it's night, you should sleep. There's something called circadian rhythm. That's your sleep rhythm. And it gets accustomed to whatever you do to it. So what you have to, there are sleep clinics, you know. They call them sleep clinics, but I'm not sure because I don't work for NHS. I'm not sure which trust have it, but you can ask your GP about sleep clinic. It's basically readjusting. Sometimes you don't even have to do anything. What you could do is just don't have any naps in the day. No matter how you feel, do not nap. I see you laughing, you're probably guilty of it, but don't have any naps. And have physical activity, right? And over time, your body is going to, that circadian rhythm in your brain is going to readjust back to sleeping at night. I used to work a lot of night shifts. And when I wanted to regulate after doing a series of nights, I will do just what I'm telling you and probably go to the gym. So when I'm home, when I come back, I don't care if I want a nap, I'll wait, and that's how I'll regulate. But it's not easy. That's insomnia, and there is medication for it. But because I work in substance misuse, I don't advise people to take these because it's hard to wean off of them. It's best to try to do it naturally. And you see soursop leaf. Soursop leaf is highly sedative, but I don't know where you would really get that here. Normally you have to just find the tea, but you see soursop, the leaf. You have some? I think I have some at home. But yeah, soursop leaf, when you draw it out and drink it, especially if you do it strong, it would eventually make you sleepy. And chamomile. And the chamomile tea is very effective. And the Swinnings brand, they have a sleep tea. The one with the purple color is good. I don't even remember all of the ingredients, but that, if 1 cup isn't enough, drink 2. Put 2 tea bags in the same amount of water and give it time.
Just to add quickly to Brother Francis. Brother Francis, the easiest way to get rid of sleep, to get rid of insomnia, is to start reading your Bible. Serious. Ask my husband. Just start to read your Bible. No, seriously, it works. You go to sleep quickly because the devil don't want you to be up reading. It's the quickest way for you to fall asleep. Serious. No, it's true. I had a patient recently, and he was speaking to me, and he said, "I tried everything. I tried the medication, the doctors, this blah 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 blah." I say, "Open your Bible, start read Psalms," and that was it.
One had been on medication, diabetes medication for some time. And happens that he's now free from that diabetes, either type 1 or type 2. Will it be advisable for that person to continue with the medication just to prevent it at all from coming again or not? I want to know.
I don't really think I understand. Are you saying that when you're taking the diabetes medication and it's
And
not
you are-
working like it should?
Yeah, and you are the person is free from that diabetes.
Oh, so you don't have
It's
it anymore?
You don't have it anymore.
No, you'd stop taking it or you'll kill yourself.
You stop taking.
If you don't have it anymore, that's what we call healing as Christians, or what the doctors will call remission. If your A1C goes down to normal
Yeah.
for more than 3 to 6 months, they will tell you you're in remission and they will stop your meds.
Oh, okay. So
However, if
it's not good to take any other medication just to control its coming
But then
again.
why would... No, that's your diet. It's your diet that would help it to not come again.
Oh.
Yes, we need to... You see, we were taught as black people, our diet is full of carbohydrates. But as I was saying earlier, you can go for days without eating a carbohydrate, and you will be fine. Yes, we were taught the wrong way to eat. Our ancestors were slaves, so they had a lot of starch. So to give them the energy. And the slave masters, they gave them the scraps of the meat, the protein, when they had the lean meat. So some of this comes down from culture as well. But when you know better, you do better. If when you're on medication, you have to be careful, because it could be the amount of medication that you're on that makes you go into remission. So to stay in remission is really your diet and your lifestyle. Yeah, and when you get to that, you don't continue.
You don't continue.
Because it would make it go down and kill you. If your blood sugar goes down below 3.2 and it stays like that, you could go into coma. So it's about constant monitoring.
Okay. Thank you.
Thank you very much. Thank you all very much for listening to us. It was indeed a great pleasure. Muchas gracias a todos.